Welcome to this proficiency case study. Proficiency uses immersive simulation training to enable a consequence-free environment for investigators, site staff, CRAs, and monitors to practice critical aspects of the protocol prior to study initiation. Our technology has the ability to both assess decision-making capability and also to mentor the competency gaps that are detected. The following case study validates this hypothesis. We co-presented these data with the sponsor, Pro-Kidney at Scope, in 2023, so this study involves the injection of autologous stem cells into the patient's kidney cortex. In about 30% of injections, there's an acute, idiopathic, hypotensive event. The patient's blood pressure drops dramatically. The natural reaction of the interventional radiologist investigators is to stop the procedure when this occurs, and possibly even send the patient to the ER. The proper course of action is just to continue the injection. The blood pressure drop is transient and does not pose a significant safety risk to the patient. After the injection is finished, the blood pressure returns to normal. The investigators had all read the protocol and attended the IM, but when presented with an actual simulation of the situation, 86.3% of them stopped the injection, as evidenced by this heat map. Here, you see the investigators divided into 3 cohorts. The gray indicates that the proper decision was made and no further training was required. The yellow indicates a mistake was made, and the system then initiated mentoring, which was successful at remediating that competency gap. The red indicates that heavy mentoring was required to move them to the correct decision. In this case, only 13.7% made the right decision, and this particular protocol violation would have caused the patient to exit the study, as the cells are only viable for a brief period of time once thawed. 39% responded to the light mentoring and 47% to heavy mentoring. We are a bit less confident with the 47% that they are ready to implement this procedure. Here you can see the corrective action explaining the proper response to the situation. Because of the criticality of this particular decision, we decided to produce a second simulation of the event. 6 months later, none of the investigators had actually performed a procedure yet, so that provided an opportunity for us to confirm that the proactive remediation worked as anticipated. Here is the second case simulation, and we elevated the CV risk in this one by giving the patient hypertension. So we started the second injection, the blood pressure drops again, and now 86% made the correct decision, and only 13% required light mentoring, and less than 1% required heavy mentoring, which was 1 investigator. We see study training as an opportunity to engage sites and give them the tools they need to properly execute your studies and deliver clean data that is not contaminated with unnecessary deviations and errors. Thank you for your time and attention, and we look forward to further discussions.